So today we will be going through autonomic function test, right? Okay. So for autonomic function test, it is a practical topic, but we have decided to cover it in the lecture class, right? Because it's a demonstration topic. You don't have to perform autonomic function test, but you need to know what are the components of autonomic function test and how to perform the individual test under the autonomic function test, right? Okay. I guess all of you are aware of the autonomic nervous system, the sympathetic and parasympathetic subdivision, right? And the autonomic nerve fibers which innervate almost all the organs. So, say for example, your heart is having sympathetic supply as well as parasympathetic supply, and usually during organ innervations, one component like sympathetic does one thing and parasympathetic will be doing the opposite thing, right? So, for heart, sympathetic system increases your heart rate, increases the contractility of heart, and parasympathetic system it reduces heart rate, right? Okay. Sympathetic system innervates through noradrenaline and parasympathetic through vagus acetylcholine, right? Okay. Now, first of all, why to do autonomic function test? Whom are the patients you will perform autonomic function test? Okay. So, there are lots of diseases or pathologies that affect our nervous system, okay? And depending on the diseases, usually the sensory system affected or the motor system affected or the autonomic function is affected or both. Say for example, the most common disease, diabetes mellitus, okay? It starts with sensory neuropathy, okay? It starts with sensory neuropathy. So, usually it affects your sensory nervous system, okay? Your sensory nervous system, the nervous system which deals with sensation of touch, pain, temperature. So, these sensations are altered at the beginning and it is usually axonal neuropathy, okay? So, when the nerve is diseased, we call it neuropathy, okay? We call it neuropathy. And to start with, diabetes is a sensory neuropathy. Your sensory nerves are damaged. Patients, sensory nerves when diabetes is uncontrolled, hyperglycemia is uncontrolled for a long period of time, sensory nerves are damaged, right? So, an early diabetes patient will complain you of sensory neuropathy, right? Like the tingling sensation, okay, or pinprick sensation, right? So, abnormal touch, pain, temperature sensation will be there, okay. But for long standing diabetes, there might be other neuropathies as well, okay, and it may also involve the autonomic nerves, right. So, there are different types of disease, some are sensory neuropathies, some are motor neuropathies, some are both, and some also involve the autonomic nervous system, okay. So, I am not here to classify the diseases and give you names of all diseases, because all those things will be burden for you. Gradually, when you study pathology, when you study medicine, you will know the name of different diseases which involves our nervous system, right. So, you can remember a few common diseases like that involves our nervous system, like most commonly diabetes mellitus, then your HIV neuropathy, some poisoning like lead poisoning, right, and some viral infections like some autoimmune neuropathies like Guillain-Barré syndrome, right. So, these are all the diseases which affects your nervous system. Now, today we will specifically test the autonomic function, the sympathetic function and parasympathetic function. So, how to test a patient who has got autonomic dysfunction, okay. And yes, again diabetes is a very common thing that involves our autonomic nervous system, right. And nowadays these things, autonomic nervous system testing or autonomic function testing is crucial, because with this we can detect very early diabetes, okay, very early diabetic neuropathy. We can detect diabetes in an early stage, okay. Okay, so these are the few gross indications of autonomic nervous system testing. Now, I will be telling you what are the components of autonomic nervous system testing and how to perform that. Okay, it is actually a practical topic, but today we are covering this in a lecture class, because you don't need to perform this testing in your examination, but you will be asked question how to do it, and you need to have concept how to do how to perform autonomic function testing on an individual, and what are the components, what are the tests for sympathetic system and what are the tests for parasympathetic system, right? Okay. So, our learning objective is to perform autonomic function test in the given subject, and aim is to examine the autonomic function test. So, autonomic nervous system, it is the portion of the nervous system that controls most of the visceral function, all of you know, right? And it controls the arterial blood pressure, gastrointestinal motility and secretion, urinary bladder emptying, sweating, body temperature, and it has got few features, right? The autonomic function. So, number one is rapid, its action is quick, okay? So, rapidity and intensity, its action is rapid and intense. Second, the center is located in the spinal cord, brainstem and hypothalamus. Operates through visceral reflexes, it has got efferent innervations through parasympathetic and sympathetic subdivisions, right? And most organs are having dual innervation. Almost all organs are having dual innervation. That means it has got both sympathetic and parasympathetic supply. Your urinary bladder, your heart, your gastrointestinal tract. So, everyone has got dual supply, both sympathetic supply and parasympathetic supply, right? Okay. And definitely there is a balance between the sympathetic and parasympathetic subdivision, and which is regulated on moment to moment basis by afferent signals, okay. So, balance is important. What I want to focus is this balance is important, balance between sympathetic and parasympathetic system, okay. So, your heart rate is constant in a particular range. This is because your sympathetic system and parasympathetic system constantly fighting each other, right? Your sympathetic system is trying to increase your heart rate and your parasympathetic system is trying to decrease your heart rate, and there is a perfect balance and your heart rate is maintained in a particular range, right? It is neither increased nor decreased, right? But once there is autonomic dysfunction, either sympathetic or parasympathetic system will win, and there will be some symptoms or some signs like increase in heart rate or decrease in heart rate, like that, okay. Okay, so classification, classical autonomic function test, okay, classical autonomic function test. So, we have tests for sympathetic system and we have tests for parasympathetic system, okay. So, remember those tests, these tests are very easy, right, okay. So, test for sympathetic system, postural challenge test, okay, I will be explaining in the subsequent slide. Postural challenge test, head up tilt test, or it is also called the tilt table test, right. Sustained hand grip test, cold pressure test, and test for parasympathetic system are basal HRV or heart rate variability, basal heart rate variability, Valsalva ratio. I am coming to it. What is Valsalva ratio? What is Valsalva procedure? Right? Heart rate variation with respiration. It is also called EI ratio. Inspiration, expiration is to inspiration ratio, and 30:15 ratio. Heart rate response to standing. Okay. Very easy tests. Just you need to remember few things. Very easy test and very easy to interpret as well. Okay. But nowadays there are few sophisticated autonomic function testing that you should remember the names only, right. But these are the basic tests for autonomic function, right. Other tests just remember the names. So, for these other tests like the sympathetic skin response SSR, quantitative pseudomotor axon reflex test or QSART, and laser Doppler velocimetry for skin blood flow. For these things, for these three tests, we need sophisticated instrument. Just remember the names, right? Just remember the names. Procedure is also not required for your level. These are very advanced tests for autonomic function. Okay. The basic test you need to remember in detail. Okay. but these are few advanced tests. We need sophisticated instrument or equipment for this to perform. Also, we don't have this instrument in our college right now, right? These are very sophisticated instruments, right? Okay, but we will discuss the basic tests one by one. So, postural challenge test, extremely easy. So, to assess the integrity of the sympathetic system, postural challenge test. Some part of it you have also performed in your practical examination. So, 5-minute rest in the supine position, okay. Take rest for 5 minutes for the patient, 5-minute rest in supine position, then basal blood pressure is recorded, okay, baseline blood pressure after resting condition, right. Now, the subject is instructed to stand up without any support, okay. The patient should stand without any support, without the support of hand, right, and remain such for 2 minutes. And blood pressure recorded again. So, what should happen when the patient stands? What should happen to patient's blood pressure? Anyone? Blood pressure should increase or decrease? Decrease. Increase on standing. Why? Yes. What should happen to the systolic blood pressure and what should happen to diastolic blood pressure when the patient stands up? Without support, okay. If I take support of my hand, then there will be different thing, but if without support I stand up, what will happen? So, the mechanism is immediately after standing, there will be gravitational pulling of blood into the lower extremity, okay, gravitational pulling of blood into the lower extremity, and it will reduce the venous return. Venous return will reduce immediately. So, stroke volume will be reduced, right. So, decreased systolic and diastolic blood pressure, okay, decreased systolic and diastolic blood pressure, and baroreceptor are less stimulated because mean arterial blood pressure will fall. So, baroreceptor will be less stimulated and blood pressure returns to normal in 15 seconds, okay. So, this fall in systolic blood pressure and fall in diastolic blood pressure immediately after standing is usually below 30 millimeter of mercury for systolic blood pressure and below 10 millimeter of mercury for diastolic blood pressure. But if you find abnormal fall of systolic blood pressure by more than 30 millimeter of mercury and abnormal fall of diastolic blood pressure by more than 10 millimeter of mercury, this is definitely abnormal, okay, and we call it orthostatic hypotension. We call it orthostatic hypotension. It is definitely a problem in the sympathetic system because you know baroreceptor, it works through sympathetic system. It sends signal to the NTS, nucleus tactus solitarius in your brainstem, and finally there is different sympathetic output, right. So, once these sympathetic fibers are damaged, this homeostatic mechanism will not work and the patient will be having hypotension. Once the patient stands up, matha ghure jabe, right, the patient will fall. We call it orthostatic hypotension, okay, orthostatic hypotension. So, it is a problem in the sympathetic system, right. Okay. Now, head up tilt test, what is that? So, we need a tilt table for it, we need ECG monitor and we need NIBP, non-invasive blood pressure measurement for this, okay. So, how to perform that? Again, it is a very simple procedure, right. The subject relaxes in the supine tilt table for 10 minutes, okay. So, tilt table, it is a table, so where the patient lies down and we can tilt the table. So, without support patient can stand or we can keep the patient at an angle as well. See the picture, okay. So, here is the bed or the table where patient lies down with the ECG monitor attached, okay, and blood pressure cuff is also attached, right. So, we can continuously monitor patient's ECG and blood pressure, and here is the tilt table, and we can tilt the table from this horizontal position to 30 degree, 45 degree, 70 degree, 80 degree. In this way we can tilt the table. So, passively the patient is standing, but passively, okay, without any support, not even using our own leg muscles, right. So, passively making the patient standing, okay. So, The subject relaxes in the supine position for 10 minutes, ECG and blood pressure being recorded, baseline heart rate and blood pressure recorded. Now, position of the head side of the tilt table, it is inclined at an angle of 80 degree from the horizontal, right. Now, again immediately record heart rate and blood pressure and at 1 minute interval for a period of 3 minutes. ठीक है? So, first basal heart rate and blood pressure measured, then make the patient tilt at 80 degree angle, again measure heart rate and blood pressure at every 1 minute for a period of 3 minutes. Okay. Okay, again the mechanism is quite same, changing the position on the tilt table, pulling of 30% venous return in the peripheral circulation, cardiac filling pressure decreased, stroke volume decreased by 40%, heart rate rises immediately due to withdrawal of the parasympathetic activity and then due to increase in the sympathetic activity, again due to baroreceptor activity, right. So, clinical significance, when to do that? Unexplained syncope, somebody is having unexplained syncope, okay. मतलब रिपीटेडली होता है, ठीक है, क्लास में गया पेशेंट देखने के लिए गिर गया, ठीक है, फिर डिसेक्शन क्लास में गया गिर गया, ठीक है, तो फ्रीक्वेंटली ये एपिसोड होता है किसी का, तो दिस इज ए डेफिनेटिव इंडिकेशन. लास्ट 6 मंथ्स में 3 और मोर टाइम्स अगर होता है सिंकोपल अटैक, देन दिस इज एन इंडिकेशन. किसी को हुआ है? एनीवे, सो दिस इज एन इंडिकेशन टू डू टिल्ट टेबल टेस्ट. ओके. Okay, so clinical significance in the diagnosis of multisystem atrophy and unexplained recurrent syncope. Again, it is a test for both sympathetic and parasympathetic system. Now, sustained hand grip. Sustained hand grip, again we have an instrument called hand grip dynamometer. Okay, hand grip dynamometer. So, see the here is the instrument, hand grip dynamometer, okay, hand grip dynamometer. So, here is a spring action. So, when it is released, this will be at 0, right. Now, you pull it with your dominant hand, you pull it with your dominant hand, okay, pull it with your dominant hand and take it to the maximum, your capacity, right. And after that, say for example, this is 0 and this is 100 kg, okay, this is 100 kg. Now, say for example, I am pulling it and my maximum capacity is, say for example, 45 kg, okay. Now, 30% of 45 kg, say for example around 15 kg, I need to hold that at 15 kg for a maximum period of 2 minutes, jotota সম্ভব. Okay, and I will record the blood pressure in the opposite arm. Okay, so let me explain the procedure again. Okay, so basal heart rate and blood pressure recorded. Basal heart rate and blood pressure recorded. Now, the subject is asked to grip the hand grip dynamometer maximally with his dominant hand. Okay, maximally with his dominant hand, and 3 successive trials are given and the highest record is taken. Okay. Say for example 60 kg for 55 kg, 50 kg, then take 60 kg. Okay. So, the maximum tension, it is called Tmax. Tmax is recorded. Now, hand grip dynamometer is maintained steadily at 30% of the Tmax. 30% of the Tmax, right? 30% of this Tmax, and the voluntary contraction is recorded, right? Maximum for a period of 2 minutes. ঠিক আছে, আমি যদি ডমিনেন্ট হ্যান্ডে 60 কেজি লিফট করতে পারি হ্যান্ড গ্রিপ ডায়নামোমিটারটা, তাহলে তার 30% অ্যারাউন্ড 18 কেজি, ঠিক আছে, তাহলে 18 কেজিতে ধরে রাখতে হবে কতক্ষণ? ম্যাক্সিমাম 2 মিনিট, 2 মিনিটের ভেতরে যতক্ষণ সম্ভব, ঠিক আছে. নাও ইফ আই এম ডুইং দি ম্যানিউভার উইথ মাই রাইট হ্যান্ড, আই উইল মেজার মাই ব্লাড প্রেশার ইন দি লেফট হ্যান্ড, রাইট, লেফট আর্ম. Now, blood pressure and heart rate is recorded every minute in the contralateral arm, okay. And normal response is increase in diastolic blood pressure. Normal response is increase in diastolic blood pressure by 15 millimeter of mercury and heart rate by 30%. Okay, this is the normal response. This should happen in a normal, healthy individual. Now, the mechanism, rise of diastolic blood pressure is purely due to sympathetic activity, and rise in heart rate, it is due to parasympathetic and increased sympathetic activity, decreased parasympathetic and increased sympathetic activities. It is a test mainly for sympathetic, but few parasympathetic component is also there. And this response do not depend on age. Okay. Now, cold pressure test. Again, it is an easy test. First, you will measure the baseline blood pressure. The subject is asked to place hand in cold water of 4 degrees centigrade for 2 minutes. যে হাতটা cold water এ ডোবাবে অন্য হাতে blood pressure measure করতে হবে, right? Okay. Now, blood pressure is recorded in the contralateral arm immediately after placing the hand in cold water, and thereafter every 30 seconds until blood pressure returns to pre-test level or normal level, basal level, right? And the maximum increase in systolic and diastolic blood pressure are recorded. Normal response is increase in systolic blood pressure by 20 millimeter of mercury and increase in diastolic blood pressure by 10 millimeter of mercury. This is called cold pressure test, and this test is a classical test. This is only for purely sympathetic function. Okay, cold pressure test is purely for sympathetic function, and it requires standardization with age and gender. So we cannot say specifically ki after cold pressure test diastolic blood pressure should rise by 20 millimeter of mercury or 10 millimeter of mercury. We cannot say that because it depends also on age. So we need a standardization chart for the age as well. Now, heart rate variability or HRV. Okay, heart rate variability. If I ask you what is your heart rate, if you say it is 80 per minute or 72 per minute, then there is some problem, right? Because your heart rate is not fixed. Okay, even if you check your ECG, right? You check your ECG. How to measure heart rate from an ECG? You need to measure RR interval, right? The number of small square between two R wave, right? And you divide it 1500 divided by number of small square in terms of RR interval, right? So if you take only the lead 2 of ECG, okay, if you calculate heart rate, it will change, right? It will change from bit to bit. Okay. So say for example, this is R in this way, right? So here is R1, R2, R3, R4, R5, Rn. So we have a long strip recording of your ECG lead 2, right? And the formula of heart rate is 1500 divided by RR interval, correct? 1500 divided by RR interval is your heart rate. But which RR interval you should consider? Is it R1 this interval, R1 R2 or R2 R3 or R3 R4 or what? Okay. Now the question is which RR interval you should consider? Okay. Yes, you can consider any RR interval. You can consider any RR interval and take out your heart rate. Okay. So say for example, between R1 and R2 you have say total 20 small squares. 20 small squares. Here you have 22 small squares. Here you have 21 small squares. Here you have again 20 small square. Here you have 19 small squares. So your heart rate can be 1500 by 20, 1500 by 22, here 1500 by 21, here 1500 by 20, and here 1500 by 19. So your heart rate is basically changing. Here it will come 75, your heart rate, okay, and here it will come around 68, okay, 68. So your heart rate is changing, okay, 70, 68, sometimes 69, sometimes 70, whatever. Your heart rate is changing bit to bit, right? And this is the proof that your sympathetic system and parasympathetic system, they are working and they are fighting with each other, and this is absolutely normal, right? This is absolutely normal. So if you say your heart rate is fixed at 75, there is a problem. It should not be fixed, right? So, your heart rate should be keeping on changing, right, and this is called heart rate variability. The more is the heart rate variability, the more is good health, right. Okay, so heart rate variability is normal thing. Once this heart rate variability is lost, then there is some problem in the autonomic nervous system. Okay, then there is some problem in the autonomic nervous system, either your sympathetic and parasympathetic system, there is some dominance, either it is sympathetic dominance. Okay, parasympathetic fibers are lost, right, parasympathetic they are early to lost. So, parasympathetic fibers are damaged. So, as a result there is sympathetic dominance and your heart rate is fixed and this is abnormal. Okay. So, heart rate variability is normal, eta barle bhalo. Okay. So, basal heart rate variability, how to calculate the basal heart rate variability? Again, you make the patient lie down for 5 minutes and lead to ECG is recorded for 1 minute continuously, only lead to ECG is recorded for 1 minute, right, and the minimum and maximum RR interval is identified, minimum interval and maximum interval. Say for example, এখানে R1, R2, R3, R4 এরকম করে R19, R20 এক মিনিটে যতগুলো হলো, ঠিক আছে, এক মিনিটে যতগুলো হলো ততগুলো RR interval I have recorded, right, and say for example the minimum RR interval is 18 and maximum RR interval is 25, ঠিক আছে, small squares, 18 small squares and 25 small squares, right. So, the minimum and maximum RR interval is identified and converted into heart rate, right. Okay, so you get your maximum heart rate and your minimum heart rate within that 1 minute. Within that 1 minute, you get your maximum heart rate and minimum heart rate. We can also, as because your statistical knowledge is less, but we express heart rate variability in various terms like SDNN, standard deviation, in RMSSD. Okay, so there are many statistical way of expressing heart rate variability. Okay, we can express it in standard deviation, SDNN or RMSSD, root mean square of standard deviation, right. Okay, so gradually in your community medicine we will discuss, in your statistics class, biostatistics class we will discuss how to calculate standard deviation and all those things. Okay, so for now just remember, you take 1 minute of ECG recording, you take the maximum RR interval and you take the minimum RR interval. From maximum RR interval you get the lowest heart rate and from the minimum RR interval you get the highest heart rate. Okay, so you get your highest heart rate and lowest heart rate, and the more is the difference between the highest heart rate and lowest heart rate, the more is the heart rate variability. Okay, and heart rate variability beshi hoy bhalo. Okay, now 30:15 ratio heart rate response to standing. Okay, the subject is asked to lie supine for 5 minutes and next asked to stand erect unaided as quickly as possible with the ECG leads connected. ঠিক আছে, পেশেন্টের ECG lead connect করা আছে, সেই অবস্থায় আমি পেশেন্টকে দাঁড়াতে বলবো, correct. Now the ratio is calculated as the ratio of maximum RR interval around the 30th bit to the minimum RR interval at around 15th bit. ঠিক আছে, মানে R1, R2 এরকম করে R15 আর R30, ঠিক আছে, এই দুটো বিটে আমি RR interval calculate করব. Okay, so the ratio is maximum RR interval which is occurring around 30th bit and minimum RR interval which is occurring at 15th bit. This ratio is called calculated and the normal ratio is more than 1.21. Okay, normal ratio is more than 1.21. So, what is the mechanism? Immediately after standing, gravitational pulling of blood into lower extremity, decrease venous return and stroke volume, baroreceptor less stimulated and there is tachycardia. Okay, there is tachycardia. Heart rate reaches maximum at 15th bit, then it slows down at a stable at 30th bit. This is why 30th bit and 15th bit is taken. So, 30:15 ratio is the measure of parasympathetic function and it decreases with age. Okay. So, it is normal that 30:50 ratio will drop with the age because it is a function of parasympathetic system. So, normally there is a pace with aging parasympathetic function is lost or is diminished, but when the patient is diabetic, this decrease in parasympathetic function is quite fast and aggravated, right. So again you can detect orthostatic tachycardia from this thing, postural or orthostatic tachycardia, 30:50 ratio less than 1.04 or the heart rate fails to decrease from 15 to 38 beat, it is a diagnostic of orthostatic tachycardia. Now come to the major part, Valsalva ratio. Okay, Valsalva ratio or Valsalva maneuver. What is Valsalva ratio and what is Valsalva maneuver? It measures both the sympathetic function and parasympathetic function, right. Valsalva ratio, it measures both the sympathetic function and parasympathetic function. How to do that? What is the maneuver? Let us check. So, the subject is asked to sit in semi-recumbent position. Okay. Now, the subject is asked to blow air through a mouthpiece. Okay. The subject is asked to blow air through a mouthpiece and hold it at 40 millimeter of mercury for 15 seconds. Okay. So, here is a mercury manometer. I can blow it and the mercury will rise. The mercury will rise to 40 millimeter of mercury and I will maintain it at 40 millimeter of mercury. Neither I will raise it further nor I will decrease it below 40. So, I should hold it at 40 millimeter of mercury for a period of 15 seconds. Okay. So, ask the subject to blow air through a mouthpiece connected to a mercury manometer and maintain the expiratory pressure of 40 millimeter of mercury for a period of 15 seconds. Okay. Now, subject practices this maneuver quite well because this needs the practice. You need to maintain at 40 millimeter of mercury. Okay. So, subject practices the procedure very well and the test is performed thrice, 3 bar perform kora hoy and the best is taken. The mean values are taken for the result. ECG is monitored throughout the procedure. Throughout the procedure, ECG is monitored and indirectly your blood pressure and heart rate is also monitored, right. তাহলে কি করতে হবে, একটা ম্যানোমিটার পাইপ আছে, সেই ম্যানোমিটার পাইপে ব্লো করতে হবে আর 40 মিলিমিটার অফ মার্কারিতে আমাকে প্রেসারটা ধরে রাখতে হবে, রাইট। এটা কতক্ষণ করতে হবে? 15 সেকেন্ডস। ওকে, এই থ্রু আউট 15 সেকেন্ডস আমার এনআইবিপি কানেক্ট থাকবে, ইসিজি কানেক্ট থাকবে, রাইট, সো দ্যাট আই ক্যান গেট মাই ব্লাড প্রেসার ডেটা অ্যান্ড হার্ট রেট ডেটা। And here is the result. Here is the result for blood pressure and here is the result for heart rate. Okay, here is the result for blood pressure and here is the result for heart rate. So, you see heart rate highest here and lowest here, heart rate highest here, lowest here. Okay, and the Valsalva ratio, what is Valsalva ratio? Valsalva ratio is the longest RR interval during phase 4. Longest RR interval means shortest heart rate. Okay, longest RR interval in phase 4 divided by shortest RR interval in phase 2. Okay, phase 4 মানে এই জায়গাটা phase 4 এ সবচেয়ে কম যে হার্ট রেটটা হবে সেটা এখানে আমি RR ইন্টারভাল নিচ্ছি, তাহলে ম্যাক্সিমাম RR ইন্টারভাল হবে, আর এখানে আমি সবচেয়ে বেশি হার্ট রেট যেটা সেটা নিচ্ছি, সবচেয়ে বেশি হার্ট রেট মানে শর্টেস্ট RR interval, right. So, the formula, you remember the formula, what is Valsalva ratio? Longest RR interval during phase 4 and shortest RR interval during phase 2 and normal is more than 1.45. More than 1.45 is normal. And failure of heart rate to increase during strain due to sympathetic dysfunction and failure of heart rate to decrease in strain release is due to parasympathetic function. যখন আমি strain করছি তখন heart rate বাড়ছে because of sympathetic and যখন strain release করছি তখন heart rate কমছে due to parasympathetic function. ঠিক আছে? Now expiration inspiration ratio, last one, expiration and inspiration ratio. Okay, the subject is allowed to lie down for 5 minutes with the ECG leads connected. Again you measure the baseline heart rate and blood pressure and ask the subject to take deep inspiration and expiration, each lasting for 5 seconds. So, 5-second inspiration and 5-second expiration, total time 10 seconds, and continuous ECG lead to is recorded, right. And the ratio of mean 6 maximum RR interval during expiration and mean 6 RR interval during inspiration. This ratio is taken. Okay. No need to take snaps, I will share in the group, right, because this thing is not given in your book, and but question comes from this segment, right. Okay. So, the ratio of mean 6 RR intervals during expiration and mean 6 RR interval during inspiration, this ratio is taken, and the normal expiration-inspiration ratio is 1.2 in the age group of 21 to 25 years, and it decreases with age. Okay. It is mediated by parasympathetic innervation of heart, and heart rate response to deep breath is a classical parasympathetic test. It is a test for your parasympathetic system. Okay, that is it. I repeat this thing, just remember the names because it is asked in the Viva examination. If your long question does not come from this segment, but at least you should face Viva examination, Viva OC examination, where the name of the tests are asked. In your Viva examination, question is what are the classical tests for autonomic function test? So, you should say these are the tests for sympathetic system and these are the tests for parasympathetic system. That much you should remember, right? That much you should remember because autonomic function test is not a zone for long question. You should face short questions or maximum short notes, right? This is not a zone for long question, but you should remember the classical test for autonomic function test, and you should at least name them. Okay, and we will be doing this thing in our practical classes. This is sustained hand grip test or hand grip dynamometer test, which is a very typical test for sympathetic system. We will perform that. We have that instrument and we will perform that, right? Okay, so your job is to remember all those tests and at least few lines how the tests are performed, right? And remember the modern test like the sympathetic skin response and QSUT, okay? Sympathetic skin response and QSUT and laser velocimetry. These are very modern tests, okay? Whatever the test I have told right here, the inspiration-expiration ratio, 30-15 ratio, then the Valsalva maneuver, these tests are classical tests, and nowadays these tests are almost going. We are not depending on these tests because these tests are quite errorful. Okay, if you perform this test like the patient is supine position, then standing, immediately recording blood pressure, so it gives you errors, right? So nowadays more sophisticated tests are coming, and out of these sophisticated tests you have most important two tests are SRS, sympathetic skin response, and the QSUT, and nowadays the laser velocimetry of blood flow is also coming up, right? So that's it.